Let me now bring in, for Republican perspective, former governor of Massachusetts, Mitt Romney, also former presidential candidate. Let me just start right out there, Governor, with the public option. Is that a red line for Republicans? If there's a public option in this plan, should Republicans reject it?
Yeah, of course they should. Look, let's start off from the very beginning, which is Republicans recognize and have said for a long time we've got problems in health care. We need health care reform. And, you know, we took that on in Massachusetts. We decided we wanted to get everybody insured. We've done that. I understand that the president considers his plan in some respects following the model of Massachusetts. Let's learn from our experience. And that is, we got everybody in our state insured. Some 98% now are covered by insurance. And we did not have to put in place a government plan. We have competition in the health insurance market. There are hundreds of health insurance companies that all compete with each other. We don't need to have the government get in and create a health insurance company in order to have competition. We've already got it. And let's be clear here, George. This is not about getting competition in health insurance, which is already there. This is instead a Trojan horse. Barack Obama, when he ran for office, said he's in favor of a single-payer system. He said it for years. This is a way of getting government into the insurance business so they can take over health care. It's the wrong way to go, and every single Republican and every thinking Democrat who knows something about the private sector would realize the wrong thing for America is to get government into the health care business.
Except, Governor, you did bring up the Massachusetts plan, and you're exactly right. And most studies have shown that Massachusetts has done a very good job of expanding coverage with this plan, but has not done as good a job of controlling costs, and some say that's because of the absence of a public plan. Alan Sager, professor of health policy at Boston University, has said that health spending per person in Massachusetts has increased faster than the national average in 7 of the last 8 years.
Massachusetts is an expensive state to do a lot of things, but the key thing I can tell you is this. What's happened to the health insurance premium for people buying insurance in Massachusetts? It's been cut in half. For an individual, a young male, let's say 35 years old, buying insurance in Massachusetts for themselves, the premium has been cut in half since our plan went in place. So the cost of buying insurance is down. And that's the course that you have to have for the nation. Look, the idea that you have to get government into an enterprise in order for that to become competitive makes no sense at all. If it made sense, we'd have a government trucking company, a government automobile company, a government clothing company, a government farm company. That just is the wrong way to go. We could get our private industry to create better products and better services. That's what's happened throughout our economy. It's what's driven our economy to be the most powerful in the world. We do not need government in the health market.
It has worked for Medicare. It has worked for veterans care, hasn't it?
Oh, it's worked terribly. I mean, look at something like Medicaid. When Lyndon Johnson signed Medicaid, he said this is going to cost about $500 million a year. Now it costs $500 billion a year, 1,000 times more. Now, I realize there's been some inflation, but not that much. The wrong way to go is to get government into an entity in our economy as large as health care and expect anything to occur besides a Trojan horse effect of a single-payer system crowding out the private markets. It would be terrible for hospitals, awful for doctors, and ultimately it would be a disaster for the people in America because they wouldn't be able to choose private plans.
Well, I actually said Medicare, not Medicaid, and a lot of experts believe that Medicare has helped eliminate poverty among the elderly. But I want to move on to national security. We saw those Iranian elections yesterday. Great deal of protests in the streets, some suggesting that this election was stolen from the opposition. I want to show you what Secretary Clinton had to say about the elections yesterday.
The United States has refrained from commenting on the election in Iran. We obviously hope that the outcome reflects the genuine will and desire of the Iranian people.
What do you think of the administration's response to the election so far, and how would you respond?
Well, first of all, the comments by the president last week that there was a robust debate going on in Iran was obviously entirely wrong-headed. What has occurred is that the election is a fraud. The results are inaccurate, and you're seeing a brutal repression of the people as they protest. The president ought to come out and state exactly those words, indicate that this has been a terribly managed decision by the autocratic regime in Iran. It's very clear that the president's policies of going around the world and apologizing for America aren't working. North Korea is not just saber rattling; they've taken the saber out of the sheath. Iran is moving headlong towards nuclearization. Russia's on the same course they were on, and all of the apologies that he provided to the Europeans have not led any of the European nations to provide additional support for us in Afghanistan. Look, just sweet talk and criticizing America is not going to enhance freedom in the world.
Others have argued, Governor, that the president's speech and the president's outreach is one of the things that led to Hezbollah being defeated in the Lebanese elections last week, and one of the things that led to such an outpouring in the streets in opposition in Iran. You dispute that?
You know, I can't tell you what led to the people running into the streets in Iran. I hope, in fact, that they're very anxious to see new leadership in that country. But I can tell you that the results are what I'm interested in. Is Iran still pursuing nuclear weaponry? And there's no question about that. And one aspect of what the president said may have been well received in Iran, but I think it was poorly received in Israel and around the world. And that's when, well, actually, he made a 180-degree flip from what he'd said during the campaign. During the campaign, when he spoke to AIPAC, he said he would do everything in his power to keep Iran from having a nuclear weapon. And then he went to Cairo and said that no single nation should have the ability to deny another nation the right to have a nuclear weapon. That is a 180-degree flip of a dangerous nature. I'm sure it was welcome in many streets in the Arab world.